Hello, my name is Jackie P., and I will be discussing the evaluation of the Route Planning Restoration Program brought about by the Federal Transit Administration. The goals of this evaluation are to prove if the program itself truly increases the quality of transit, reduces travel time, increases ridership, while caring about the population it is serving and equiting the environment. Additionally, to show the theory of change as we go through the evaluation and demonstrate to the stakeholders the success of this program. Some of the key stakeholders in this program include the federal government, the individual organizations that receive the funds, people who ride on these public transportation vehicles, and then taxpayers, since this money is coming from the federal government. Some of the program goals and background this was created due to COVID-19 to help restore routes affected by the pandemic in low-income or disadvantaged areas. It was funded by the federal government, and they allocated $25 million in grant money to these organizations, and each one can get up to $1 million if they qualify to get this grants. The goals these organizations are supposed to meet once they receive this money are to increase ridership, decrease times spent having to go from one place to the other, increase the actual quality the transit people are using, and make sure they are serving low income or disadvantaged populations who have been affected by COVID-19. A lot of times during the pandemic, we saw services and routes shut down due to money problems. So this money is to get these transit organizations back on their feet and make sure that everyone can have access to public transportation. The evaluation design I chose for this is quasi-experimental. It will also be an impact evaluation, as it will be conducted to measure the program after it was completed. We will be choosing 4 transit organizations, 2 rural and 2 urban, that are spread out across the United States. We will be talking to the Federal Transit Administration to help us come to this decision. So in choosing the specific design, there are some barriers I came into. It is unethical to withhold services from individuals, especially with this program. Grants are being allocated to disadvantaged or low-income areas who had services taken away from them due to the pandemic. It would be unfair to withhold these simply for an evaluation. Because of this, I chose a longitudinal design that falls under the category of quasi-experimental. In this design, after the program is implemented, you come in various times afterwards to measure the success or the decrease of efficiency in that program. Since I cannot have a control, I will be creating the counterfactual from pretest. In our timeline, which I will discuss later, with the pretest and the check-ins for a year and a half after the initial construction is completed. The main evaluation questions that this evaluation will cover are: did this program increase the quality of transit? Did the participants find it effective? Did they have good access to bus stops? Did this program increase the access to bus stops? And are there more routes? Are there more bus stops for them to go to so they do not have to walk a full mile or a mile and a half simply to get on a bus to go to work? Did this increase ridership? And because of that, did it increase better access to jobs, to grocery stores and health services? And then was there a general increase in individuals who took the public transportation because of the better access? The next question, number 3, did it decrease commuting time? And did grant money and construction of new routes reinstall or create more efficient routes? Next, what were the community effects? Did this program make it accessible for disadvantaged or low-income populations to get their services back and to utilize these routes? And did the cost of rides decrease? We want to make sure that the initial goals, as I stated earlier, are truly being met. And then, was this effect that they saw truly because of an increase in the funding, or was it from something else? So the sub-questions on that get into the specifics. Was it because of the increase in revenue? And then a specific question we have for the FTA is: are applicants applying and receiving needed grants? is at the top of this program are people who need this money, the people at top communicating with the people at the bottom to make sure they're getting what they need. And then was the budget spent efficient and kept within range? Here is the general timeline for the evaluation. Like I mentioned before, there are 4 transit organizations we will be working with. Each of them will have their own individual timeline as time will differ as construction is completed. So around 3 months to the estimated conclusion of construction, we will conduct pre-test at all 4 sites. Then once everything is completed, we will wait 6 months to conduct the first post-test, 12 months after initial implementation, second, 18 after we will have the third. Those will be the 4 times we will go in, the first to create the counterfactual, and then the 3 tests afterwards to collect data to make sure we have sufficient evidence for any trends or patterns we have seen to get true answers for evaluation questions. 21 months after initial implementation, this will be 3 months after the final test was concluded, we would like to have a presentation and evaluation report ready to present to the FTA, participating organizations, and any other transit organizations that would like information on data collected. Summaries will be sent to those who took surveys, and brochures will be out for further information for those who did not participate in surveys but would like to know what happened. Those will be available at the specific transit organizations. To clarify the test I was just talking about, we will have 2 different types of tests: surveys and semi-structured interviews, and then a quantitative data collection. So each of these 3 things will be done at each test. The first one is quantitative data collection. Like I said, this will be included in the pre and post test and used to show trends in time, ridership, and cost. This will be analyzed with graphs and statistics. So while this data is very good to have to show trends and patterns, outside factors such as the market or inflation could affect it and skew the data. But it is good to have this as concrete evidence to match information we get from the surveys and semi-structured interviews. So the next one, surveys. These will also be done at the 1 pre-test and 3 post-test. These will be for individuals who are using the actual public transportation. It will be conducted online. QR codes and links will be available for those to do it on their phone. It'll be a Likert scale and to measures how they see the effects of the program. Averages will be calculated, and the higher the number, the more the participant agrees that they have managed to succeed in their goals of this program. Finally, we have the semi-structured interview. These will be done again for the pre and post test with the CEOs, the 4 organizations, and FTA board members. To save money, these will be conducted on Zoom. And we will be discussing with them the evaluation questions to see if we can find any trends or patterns to match this data from the surveys and from the general quantitative data collection. While surveys and semi-structured interviews are great ways to find information, both can be subject to bias. Semi-structured interviews, you can have people veer off course or just keep quiet if they don't want to. With surveys, you could have an individual so upset with the program that they don't want to take the time to fill out the survey. So you might get a lot of positive responses, but those who feel negatively about it might not put their information in, skewing the data. So this is all something to keep in mind when you are collecting your data. Just be aware of outside environments and factors like that. To accommodate for the issue with the surveys, we will be having an incentive. If you fill out a survey, you will get a free day pass, and that can be used for anyone, since most of these people could potentially have a free pass from work or school. That survey could be passed to a friend or family member. Some of the threats to validity that I found in this data collection strategy for statistical conclusion: the unreliability of treatment implementation in low statistical power. Internal threats include maturation and testing. Construct threats include the mono method bias. And external threats include interaction of the causal relationship with outcomes and interactions of the causal relationship with settings. These are all things to look out for and adjust as you go through your evaluation. The measures and indicators we will be looking for to determine if this program is successful Well, to see if there's a decrease in the cost of riding, increase in ridership, decrease in commute time, and then if participants feel positively about the efficiency of the program, such as promotes equity, it helps the populations it was intended to help, there's an improved quality of transit, and the funding, they feel as though this increase in efficiency was due to the funding, not external factors. And that is all overall. If this is a successful evaluation, this could be used as a model for other federal programs. And it is important to evaluate these programs as taxpayers would like to see feedback as do people who participate in these programs. Thank you.